Stroke Awareness Month. So today we're talking about some warning signs of stroke and what to do if you're experiencing one. Dr. Ross Levine from Meritor joins us now with more. Thank you so much for being here.
Thank you.
And let's talk a little bit about some of the warning signs of a stroke.
Well, in terms of stroke awareness, we like to use the short term FAST, F-A-S-T. FACE deals with facial weakness on one side or the other, so we'll ask the person, the stroke victim, to smile and see if one side of the face is droopy versus the other.
Okay.
The A in FAST is for arm. We'll ask the patient to lift their arms up and see if one droops down or if they cannot lift one of the arms. The S in the FAST is speech. Is their speech clear? Can they repeat a sentence? Can they say their name, say the date? Listening for both clarity or the inability to speak words. And the T for FAST is time. All of our stroke treatments really base themselves on when did the stroke start, how many minutes or how many hours are we in when we see the patient, how far into the stroke are we to help gauge what kind of treatments are available.
Okay, and there's also dizziness, nausea, and vomiting to kind of look out for too.
Right, so additional symptoms, the worst headache of one's life,
Sure.
Severe sudden headache, dizziness, as you said, stumbling, walking, vomiting, those go along with some of the stroke symptoms as well.
Why is it so important to get help as soon as possible when someone is suffering from a stroke?
Well, I think one of the new statistics that was in our major stroke journal last week, for every 1 minute that we delay in recognizing and treating people that are eligible for stroke treatment, for every 1 minute that's delayed, that person loses 3.5 days of functionality, of being normal or near normal. So the quicker we can recognize stroke, the quicker patients are brought by, call 911 or their families call 911, brought by our EMS services to the emergency rooms in Madison and Dane County or anywhere, depending where the patient is. The sooner we can recognize, make the diagnosis, and those eligible all for treatment, the better patients do.
Okay, that absolutely makes sense. What are some lifestyle changes that we can make to help decrease the chances of suffering from a stroke?
So just like heart attack, stroke and heart attack are similar in terms of the risk, stopping smoking and not being exposed to other people smoking cigarettes or pipes or cigars, aggressively treating blood pressure, normal blood pressure numbers, the top number like under 140. Controlling diabetes. If our sugars are high, those will add to stroke. If our cholesterol profile is abnormal or our bad cholesterol is high, lowering that to control stroke. Being more active, healthier, weighing less, eating less, lower sugar, lower blood pressure, stop smoking, better cholesterol. Those are the types of things that help minimize heart attack and minimize stroke.
Absolutely. Some very useful information. Dr. Ross Levine from Meritor, thank you so much for being here. We'll have all this information up on our website as well, NBC15.com. Just click on that